Hello and welcome back to our Health and Wellness channel. We're glad to have you with us on this important journey towards better understanding of our bodies and overall health. Today, we're diving deep into a topic that's affecting millions worldwide: diabetes. It's a silent predator, often creeping in unnoticed until it's too late. But it doesn't have to be that way. Knowledge is power, and being aware of the warning signs can save you from a lifetime of complications. We're here to equip you with that knowledge. Welcome to our video on critical signs, 15 diabetes warnings you must not ignore. In this video, we will discuss the warning signs of diabetes that you should not ignore. So get comfortable, grab a notepad if you'd like, and stay tuned for some vital health information. Remember, awareness is the first step towards prevention. Let's get started. Do you know the critical signs of diabetes? It's a question worth pondering, especially when you consider the prevalence of this health condition worldwide. Diabetes, a chronic disease marked by high levels of sugar in the blood, is a global concern, affecting hundreds of millions of people, and the numbers are rising. Why the concern, you ask? Well, uncontrolled diabetes can lead to serious complications, such as heart disease, kidney damage, and even blindness. But the good news is, if it's detected early, the progression of the disease can be slowed down, and in some cases even prevented. That's why recognizing the early warning signs is so crucial. It can be the difference between living a healthy life or dealing with a lifetime of health complications, so let's get down to it. In this video, we will discuss 15 warning signs of diabetes you must recognize. It's time to take control of your health and be aware of the signs your body might be showing you. The first warning sign is frequent urination. A telltale sign that your body might be fighting a silent battle with diabetes is an increased need to use the bathroom. This occurs because your body is trying to get rid of excess sugar by flushing it out through your urine. You might find yourself waking up several times during the night to go to the bathroom, or maybe you've noticed that you're going more frequently throughout the day. This isn't something to brush off, as it can be a critical sign of diabetes. Next, we have excessive thirst. Now, we're not talking about the normal thirst you might feel after a long run or a spicy meal. This is an intense, persistent thirst that seems to be unquenchable. You might be drinking glass after glass of water, but you still feel parched. This excessive thirst is your body's reaction to the fluid loss from frequent urination. It's trying to replenish what's being lost, hence the unending thirst. It's a vicious cycle that can leave you feeling drained and dehydrated. Finally, the third warning sign is extreme hunger. This might seem a bit confusing considering the body has an excess of sugar it can't process. But here's the catch. Because the sugar can't be used for energy, your body thinks it's starving. You might find yourself eating more than usual, but still feeling weak and tired. This extreme hunger, also known as polyphagia, is your body's cry for help as it's unable to use the glucose in your blood for energy. These three signs, frequent urination, excessive thirst, and extreme hunger, are all interrelated, and they all stem from the same issue: the body's inability to process sugar. Understanding these initial signs can be the first step towards managing diabetes. Remember, knowledge is power. The more we know about our bodies and the signs they give us, the better we can respond and take action. Moving on, the fourth warning sign is unexplained weight loss. This can be one of the more puzzling symptoms of diabetes. It might seem counterintuitive at first. If you're eating as much as you always have, or maybe even more, how could you be losing weight? The answer lies in our body's use of glucose. When we consume food, our bodies break it down into glucose to be used as energy. Insulin, a hormone produced by our pancreas, helps our cells take in this glucose. However, in people with diabetes, the body either can't produce enough insulin or can't use it effectively. As a result, glucose builds up in the bloodstream instead of being absorbed by the cells. With the cells not getting the glucose they need for energy, the body starts to burn fat and muscle for fuel. This leads to weight loss, even when food intake remains the same or increases. So, if you're shedding pounds without trying, it might be time to check in with your doctor. The fifth warning sign is fatigue. When your body can't use glucose as energy, it's like trying to drive a car without fuel. You can push and shove all you want, but without energy, your body just can't go the distance. Fatigue can also be a result of high blood sugar levels, which can cause inflammation and disrupt your sleep, leading you to feel tired and worn out. Lastly, the sixth warning sign is irritability. This is often a knock-on effect of the fatigue we just discussed. When you're constantly tired, it's easy to become irritable and short-tempered. Plus, the stress of managing diabetes can also lead to mood swings and feelings of frustration. So there you have it. unexplained weight loss, fatigue, and irritability. 3 more warning signs that you might be dealing with diabetes. Recognizing these symptoms early on can help prevent further complications. The 7th warning sign of diabetes is blurry vision. It's not about needing a new pair of glasses, but a potential indicator of diabetes. This is due to high blood sugar levels causing the lens in your eyes to swell, affecting your ability to see. So, if you notice a sudden change in your vision, it's time to consult with your healthcare provider. Let's move on to the 8th warning sign: slow healing sores or cuts. You've probably noticed that minor injuries like cuts and bruises heal at a certain pace. But if you see a significant slowdown in this healing process, it might not just be age. High blood sugar levels can affect your blood flow, causing poor circulation. This makes it harder for your body to heal wounds, hence the slow healing. The 9th sign is frequent infections. Now you might wonder, what do infections have to do with diabetes? Well, high blood sugar levels can weaken your immune system, making you more susceptible to infections. This could range from skin and urinary tract infections to gum infections. So if you find yourself getting sick more often than usual, it's worth getting checked out. Lastly, the 10th warning sign is areas of darkened skin. This is a condition known as acanthosis nigricans, where certain areas of your skin, like the neck or armpits, become darker and feel velvety. This happens when insulin-resistant cells cause an overgrowth of skin cells, resulting in these dark patches. These symptoms may seem unrelated, but they all share a common cause: high blood sugar levels damaging blood vessels and nerves. They may seem insignificant on their own, but when combined, they paint a clear picture of a potential diabetes diagnosis. These signs are often overlooked, but they are critical in the early detection of diabetes. So, pay attention to your body. It's always communicating with you, and these signs may be its way of telling you that something is not right. Remember, early detection is key in managing diabetes effectively. The 11th warning sign is tingling, pain, or numbness in the hands or feet. This sensation is often described as a feeling of pins and needles and is typically the result of nerve damage caused by prolonged high blood sugar levels. It can be intermittent or constant, and is often most noticeable during periods of inactivity, like when you're trying to fall asleep. Moving on to the 12th sign, we have red and swollen gums. High blood sugar levels can lead to inflammation in the gums, making them red, swollen, and often painful. This is not just a simple case of poor dental hygiene, but a potential sign of diabetes. It might also lead to periodontal disease, where your gums pull away from your teeth and the spaces become infected. The 13th sign is itchy skin, particularly in the lower legs, elbows, and other skin folds. Dry, itchy skin can be a result of poor circulation and the dehydration that can come from frequent urination, both of which are common in those with high blood sugar levels. The skin may also become dark and thick, especially around the neck and armpits. Our 14th warning sign is frequent yeast infections. Yeast thrives on glucose, so those with higher sugar levels are more prone to yeast infections. This is especially true for women, but men are not immune. These infections can occur in any moist area of the body, like the mouth, the armpits, or the genital area. Last but not least, the 15th warning sign is unexplained mood changes. High blood sugar levels can affect your mood and lead to rapid mood swings. You might feel fine one moment and irritable or depressed the next. This is because high blood sugar levels can affect your body's serotonin levels, a hormone that helps regulate mood. Being aware of these signs can lead to early diagnosis and better management of diabetes. Knowledge is power, and in the case of diabetes, it can mean the difference between living a healthy life or dealing with serious complications. So, pay attention to your body. It might be trying to tell you something important. To recap, we have discussed 15 critical warning signs of diabetes, from constant thirst and frequent urination to unexplained weight loss, fatigue, and blurred vision. We've also highlighted signs like slow healing sores, tingling or numbness in the hands or feet, and recurring infections. Other red flags include areas of darkened skin, an increase in hunger, and irritability. And let's not forget more subtle signs like dry mouth, itchy skin, and a feeling of pins and needles. The importance of recognizing these signs cannot be overstated. They serve as the body's alarm system, alerting you to the possibility of having diabetes. Ignoring them could lead to serious complications. If you or someone you know is experiencing any of these symptoms, it's crucial to seek medical help. Remember, early detection is key. Stay alert to these signs and take action if you notice them. Thank you for watching our video on the critical signs of diabetes. If you found this information helpful, please give us a thumbs up and share this video with your friends and family. It might just save a life. Don't forget to subscribe to our channel for more health-related content. We'd love to hear your thoughts or experiences related to the topic, so please leave a comment below. And if you want to stay updated with our latest videos, make sure to turn on the notification bell. Remember, your health is your wealth. Stay informed, stay healthy.